Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to go into another case that we treated. It had a pretty bad cyst form, but we did the slow method of treating a cyst, and that's the way I think all cysts ought to be dealt with. Maybe there are some that you couldn't do it this way, and you would have to do the fast way. The surgeon goes in and completely peels the cyst out, but this is not the best way to deal with cysts. Now let me go ahead and start this case and let you see what it is. This young lady came in and she has a cyst up here. Actually, we were seeing this patient along the way, and we took some Panorex x-rays down the line, and then we carried it on the way through. So here we see that before the cyst had time to change this, and what happened, it blew this up and pushed the tooth way out of place. We had an opening in there, and we drained it and filled it with outerform gauze until the opening went down, and the tooth that was pushed way out of place, the cuspid, it comes back down in almost a normal position. Now here we had to sacrifice the bicuspids, I think, to get room in the mouth for the teeth. So let's go into this case as we'll go as fast as we can. And here's the little girl's smile. She's got a gummy smile, you can see right there, and that is right in the area where this cyst formed. Now, we're looking at it in one direction, and the tooth that caused this cyst, I'm sure, is a baby tooth that has some effect on the way they treated it. I didn't have anything to do with that, but I've noticed that is the big problem with some of this. Now we're going to look at it the other direction here, and it makes that look like it's on the other side of the mouth, but it's not. Now there is the baby tooth that has been treated a wrong way and crowned that thing, and it forms a cyst right up in there. It pushes the cuspid tooth way up out of position. Now this is a very crowded case. You see the cuspids coming in over here, and we don't have room enough in here, so we sacrifice the bicuspid. Okay, here is the lateral tooth. It's way out of, or maybe that's the cuspid tooth, way out of place. And this is the baby tooth that had a crown on it at one time, apparently, and they took it off. But this is a thing that took this follicle up and made it grow into a cyst. Now, as far as I know, it was not abscessed or anything like that. Here this deciduous tooth has been treated, but it didn't take care of the dead structure inside the tooth. Now we line this teeth up and we start opening it up, and you don't see what happened in here. That's where the cyst was, in this area. And we went ahead and finished this case out, got room, put the cuspids in place, everything. Now, this video was taken in January 21st in 91, right here. And she was, I don't know whether it's the age of her or not, but anyway, she was at least 7 or more years old when we first saw her. And this is one where they had a steel crown over it, but they hadn't treated it. Now this didn't have it wasn't abscessed, but a cyst form, and it starts growing in this area here. Now watch this tooth and this tooth, watch where they go. Now the cyst will push on deciduous teeth. It'll eat the root away, but it doesn't have any effect on the enamel structure. And on permanent teeth, they normally have no effect on the root structure of a permanent tooth. But let's watch this. This is a 91, and here's 93. Since 2 years went by before we saw this tooth. And here was the crown of this tooth, and it shoved this bicuspid up like that, and took the cuspid and crowned it over there. Now let me go back and show that to you again. Now here's the normal side with the regular deal that's going there. We put this on to shove the laterals out into place. Now I'm going to go back and show you where that tooth was. Now see, that tooth was in here, and that's the one that is pushing both of them out of place. Now, the crown on the next, see, you would take a picture, 91, and I think it's 93, 8 of 93. Some time passed, we were looking at it, so when we took this one, we saw, boy, this is really fouled up. It moved that tooth, the bicuspid and this cuspid, shoved it way up here. The root of this tooth shoved into the sinus. Now, so we treated it slow. We opened it up and kept it open and drained it. I don't have any pictures of that, but let's see, 93, and here it is in 94. We went in and took this one tooth out here, one down here, one over here, and one in this side, the bicuspids. Right, so now we got laterals, cuspid, second bicuspid right in there. Now, when we went up in here and we kept this open, this tooth changed. Now I'm going to go back and show it to you again. Look where it was. The root sticking up in the sinus. Now we see. Now, as far as I can tell, the root is out of the sinus. I don't know, but the tooth is changed. It's coming down right there. And we took out the bicuspids, first bicuspid out here to give us room for the teeth to come in. Now watch it, age 10, 4, and that was 94. And here it is 10, 9. Some time passed. Watch the root of this tooth, the tooth develop. Let's push it back up there again. And this cuspid, you see it forming up in here. The root is formed, it's pushed way back in here, and it's bending that lateral root there. And then the cuspid is sticking up in the sinus. Now when we slowly drained the tooth, they kept it open, and this tooth comes on down. The lateral tooth had developed a crooked root, and it just continues down, but you see where that root has changed there. This tooth that was going across here is going straight down into that space. Now it comes on down, and we line it up, and you can tell, you can't tell anything happened to it at all. Now on the other side of the mouth, we're still losing a couple teeth here, and the same thing over here. Now, when a permanent tooth, it has a bag on it called a follicle, and a follicle cyst, a follicular cyst, can form around it if something goes wrong and it forms a cyst that starts absorbing more and more moisture, and it grows and pushes the tooth out of place. Now, as this tooth develops, it eats the root of the baby tooth away completely. You can see this one up here eating this way. If you can keep this here, it'll even eat the cementum or the tooth structure on the baby tooth right on up into the tooth. You can see how this ate this out here, and on this side it ate that out, but it gets up here to the enamel on the tooth. It doesn't have any effect on the enamel of deciduous teeth, and it doesn't normally affect the tooth structure of a permanent tooth. But now this one cuts this root off, and it'll finally eat that away too. All right, here's just a blown up picture when we started. Here's where the cyst originated, down in here. And it formed on epithelial tissue. It pushed around this tooth, took this cuspid tooth, shoved it up in there, shoved the root into the sinus, and we opened that and drained it and kept it open for a few months, and that tooth came back down into position like that. Now, it's headed correctly. This follicle around this tooth will round it out and show this crown over in this direction. I'm just trying to get everybody that messes around with young people's teeth to understand forces that work on the teeth. And follicular forces, I tried to take this to the board of our organization, the AOS, and nobody had done anything with the follicular movement of teeth. And that is an important thing to understand if you're going to do this work and do it right, understanding follicular forces that can work on teeth. And that's what I'm trying to get across. All right, now watch that cuspid. This follicle around it is going to shove it in this direction. Watch the next picture. You see it moved it completely over, and we got it and put it onto the wire there and straightened it out. As this tooth here formed in a crook, and it stayed on that form that way, and it'll stay that way. All right, on the other side of the mouth, this is not a regular cyst, but that's got some pressure up here as if it was eating away the root of that tooth. And I think that one finally got lined up on its own and came in like that. Now I'll just show the rest of the case. We came in and put some reverse curve in that, and those teeth. These laterals were way up in here like that, and we made room over here for them. And so now the laterals up here, and we pull them up with a round wire, and we'll have to torque them a little bit to get them straightened out. Now these cuspids were sticking out down here. And now we took the bicuspid out, and the cuspids now have moved back into place. And that's the last pictures of that young lady. We went ahead and followed her through and straightened her teeth out. You would never know that anything happened to it. And that's the end of that video. And so I thank you for watching it. And we're going to start another one here pretty shortly, showing what follicular cysts do to ectopically erupted teeth. Okay.